Depending on today's findings, is there anything you'd like me to go over again or any other concern I can help with today? And with thank you for coming in. You've done the right thing by following this up. Let's get you seen quickly so we can get your hearing back on track. Acoustic neuroma in a young patient scenario. 45-year-old working in a call center. Trouble hearing on the right side. Introduction. Hi, I'm Dr. Name. One of the junior doctors here today. Can I confirm your full name and age? Thanks. And how would you prefer I address you? I understand you've come in with hearing trouble in your right ear. Would it be alright if I ask some questions to understand it better, and then examine your ears presenting complaint? Duper structured, unilateral hearing loss. Let me ask a few focused questions to understand your hearing concern better. D. Duration. When did you first notice the hearing loss? Roughly how long has it been going on? Onset. Did it come on suddenly or gradually? Other symptoms. Any ringing or buzzing in the affected ear? 17. Join GK's Plab 2 study circle here. Tinaural Complex Plab 2 or Tmegx Plab 2.0 Volume 2. Any dizziness, unsteadiness, or balance issues? Any ear pain, pressure, or discharge? Any numbness or weakness in your face? P. Progression. Has it stayed the same or been gradually getting worse? A. Aggravating factors. Is it harder to hear in noisy settings? Do you struggle to hear people on the phone or at work? R. Relieving factors. Is there anything that improves your hearing, even temporarily? A. Associated impact. Has it affected your work or daily activities? Risk factor and end screening. I'll just ask a few quick questions to rule out other causes. Any recent ear infections, sore throat, or flu-like symptoms? Any loud noise exposure at concerts, work, or while using headphones? Any recent travel involving air pressure changes? Do you use cotton buds or had water enter your ear recently? Have you had earwax problems in the past? PMAFTOSAR plus ISP. No long-term conditions. M. No regular medications. A. No known allergies. F. Brother has neurofibromatosis. T. No smoking. Occasional alcohol. O. Call center job. Headset use all day. S. Difficulty at work. Misses customer conversations. Idea. Thought it might be wax. Concern. Worried it's something serious now. Expectation. I was hoping you could tell me what's wrong or help clear it. Ent examination. A. Otoscopy. I'll have a look inside both ears with this scope. It shouldn't be painful. Pull ear up and back. Stabilize with fingers. Findings. Ear canals and tympanic membranes are normal. Bilaterally. B. Tuning fork tests. RIN. I'll place this behind your ear, then in front. Tell me when the sound stops and whether you still hear it. Result. Air conduction. Bone conduction equals RIN positive both sides. 18. Join GK's Notes 2.0 Volume 2 Weber. I'll place this tuning fork on the middle of your forehead. Tell me which ear hears the sound louder. Result. Lateralizes to left. Interpretation. Sensory neural hearing loss on right. Differential diagnosis. Supporting features. Acoustic neuroma. Unilateral SNHL. Tinnitus. Imbalance. Family HX. NF. Idiopathic SNHL. Could be sudden but patient had gradual onset. Wax otitis media. Ruled out by normal otoscopy. Noise induced. Less likely. No noise trauma. Controlled headset environment. Explanation from your history and examination. It looks like you have sensory neural hearing loss in your right ear. That means the issue is likely affecting the nerve that transmits sound from the inner ear to the brain. One condition that can cause this is called an acoustic neuroma, a non-cancerous growth on the hearing and balance nerve. It grows slowly, and often the first symptom is one-sided hearing loss or ringing. Your family history of neurofibromatosis also increases the chance slightly, so we want to rule this out properly. Management and referral. I'll refer you to an ent specialist on the urgent 2-week pathway. You should be seen within 14 days. Investigations. The ent team will likely do a full hearing test, audiometry, an MRI scan to get a detailed view of the nerve behind the ear. Treatment if confirmed. If it turns out to be an acoustic neuroma, treatment depends on its size and symptoms. Options include monitoring, surgery, or radiotherapy, and the ent team will guide you based on what's safest and most effective. Safety netting. Please return sooner or go to A&E if your hearing gets worse suddenly, you develop severe imbalance, you notice numbness or weakness in your face. Follow up and leaflet. Provide leaflet on unilateral hearing loss and acoustic neuroma. Do you feel okay with the plan? Any other questions before we finish?